maybe a minute or two, to just spend that extra minute feeling around, asking these questions, especially if you know your patient is chewing tobacco or is vaping, smoking, or use of any excessive use of alcohol. And these are the questions we want to kind of ask our patients. You see something, have them move their tongue around, lift it up, feel around their nodes under right here under the chin. You want to feel around the sternocleidomastoid on both sides, have them move from side to side. It really takes very little time. And you're not getting anything special to do these screenings. It's usually your tactile and your visual that you're screening patients with. And just be aware, like if the patient's been having a cough or feels a lump, that's on one side and not bilateral. So being aware of these while they're in your chair for their overall, whatever you're doing, a filling, a crown prep, root canal, whatever it is, be aware of just looking around. And if you notice something in their mouth, ask them, has it been there for a while? Are you aware? Did you bite into something and cut your tongue? Or if you had a sharp tooth that's rubbing against you, are you a cheek biter? You want to ask all these questions to kind of be aware of what it is. And if it's something that's been there for a little while, anything over 2 weeks, get it biopsied, whether it hurts or not, because that's one misconception that people had, and my brother including. Like you said, he worked so hard. He had built his practice from scratch, and he was 32, just turned 32 before his diagnosis. And he didn't think it could be cancer, and he had a lesion on his tongue that was hurting. And he said, cancer doesn't hurt. Yeah, cancer doesn't hurt until it's grown excessive in size, and then it's painful and it interferes with speech or eating, drinking. So not necessarily should a lesion be painful for you to biopsy it. It's any persistent red, white lesion. And, the cases, there are about 54,000 Americans getting diagnosed, and 20%, so a fifth of these cases are under the age, 50. So it is steadily increasing. It is the sixth most common cancer, according to the WHO, oral head and neck cancer. And of that, squamous cell carcinomas are 90% of them. So this is our realm. This is our field. And early diagnosis is really the key, because this is such a highly vascular area. We're close to such vital structures. The chances of metastasizing or producing secondary primary tumors is there. So these cancers do come back. And the quicker we diagnose, the better the chances, because as we get higher staging, then the survival rate is low. Like if the more you go, the survival rate in 5 years, it's 4. And the treatment is pretty invasive. If you've had patients, or if you know somebody, you're removing vital structures. Manu had half his tongue removed and grafted. Some people lose part of their jaws. They lose their ability, their facial disfiguration. You have neck dissections, removing lymph nodes if it's transferred. So it's a very extensive surgery, life-altering. So yeah, and Manu is not the only dentist. There are many other dentists who some have not survived. There was a young dentist also who had parotid cancer and passed away at a young age, in mid-30s. So really the key to survival is earlier diagnosis, and we should just be more diligent when we're screening our patients, and it doesn't take long. So, yeah.
Any symptom, like basic symptom, like hard to swallow, anything like that?
Absolutely. Hard to swallow. Or when you are coughing consistently, and it's not like, we just got over like the COVID epidemic. So it's not COVID related, or it's not, and you're not having lymph nodes that are bilateral. So let's say you have a cold and a cough, and your lymph nodes are swollen. So that's bilateral. You want something that's unilateral, persistent. Trouble chewing, even an earache, and let's say you have your patient stick their tongues out. And if it deviates to one side and has an earache, you want to think of oral cancer. And oral cancer there are 2 parts. One is the oral cavity. So that's like the anterior part of your mouth. So your hard palate, the anterior 2/3 of the tongue, the floor of the mouth, lips, buccal mucosa, all of that. So that's oral cancer. And the increased rates now is due to the oropharyngeal cancer, which is in the posterior thirds of the mouth, your throat cancers, and in your soft palate, you have a lot of that area. And those rates, and this you may or may not know, these rates have increased due to the HPV, which is the human papilloma virus. And that is the most sexually transmitted disease in the United States, not STDs, not AIDS, HPV-related transmissions, which 80% of us clear this virus in our bodies, but for some reason, in some people, it does become more becomes into cancer. So that's the reason for doing the oropharyngeal, and those are the rates that have been increasing in the last few years, last few decades. Yeah.
Thank you so much. Do you feel that we should develop any kind of other tool or like a question for patients so that we can at least have some red flag?
Sure.
Is there any guideline for anything like that?
So the guidelines are, we want to check their history, smoking, tobacco use, vaping, especially in young teenagers. Also, whether they've been vaccinated for HPV. Unfortunately,
how early can we do vaccinate for HPV?
Sure. They recommend your pediatricians will have the kids vaccinated before they become sexually active, so in their preteen, as early as 9 years old for girls and about 11-ish for boys. And it's not something that you have to get over and over vaccinated for younger kids, preteens. It's just 2 doses and you're done. There is now Gardasil is recommended and is approved to be vaccinated up to the age 45. And so people who haven't been vaccinated can still get vaccinated and protect themselves from getting infected with HPV virus later on. However, if you already have the virus in your body, it doesn't prevent you from cancer. So it protects you from new viruses. But asking patients and being honest, and these are conversations that are kind of hard. There is no screening. Like HPV is the same kind of cancer that causes cervical cancer. It causes 6 other cancers: cervical, penile, anal, and oral cancer. And there is a pap smear. And that's why the rates of cervical cancer have declined, because we have a pap smear and we can test and do an early detection. With oral cancer, there is no real way to test it, because even if you have the virus in you, it's not necessarily mean that you are going to contract the virus. So there is no salivary test. That's something in development that a lot of people are doing and coming out with. So until there's a proper screening, really tactile, you can use devices like Valscope or Google. There is brush biopsies you can do that basically are a tool to screen. So they don't detect. The only way you can detect is if you do an incisional or an excisional biopsy. So if you see a lesion that worries them, never tell your patient you think this is cancer. But have them do the biopsy, and the earlier it's better. So, but yeah, these are the questions you want to ask. You want to know their social medical history. Are they immunocompromised? Do they have other cancers? Because breast cancer, pancreatic cancer, lung cancer, these can metastasize into oral cancer. So knowing their past medical history, their immune system, any past medical history of cancer, these are all like some warning signs that you should be aware of.
Yeah, a lot of dentists are not trained for even eliminating or educated guess whether something very suspicious or something that they can be under control for short period of time before they refer to a specialist. For example, you mentioned 14 days, 2-week revisit, evaluate. If it doesn't go away, send them to a specialist. Or if you know how to do biopsy, right? But dentists, some of them don't have that background, and sometimes just a little thing they just refer out. But rather than having this protocol, check with a patient in 2 weeks, if it doesn't go away, isn't it good time to a referral?
Yeah.
So those are a little bit basis protocol for oral pathology evaluation before we refer out.
No,
And
absolutely.
you agree with me? Yeah. What about the rate of survival if we diagnose uh, early stage? Isn't it highly survival rate? But
Yes,
it
it's a
was.
yeah, the survival rate's pretty high. I know lots of oral cancer survivors as well. Again, once you're diagnosed early, the treatment protocol is surgery,
Mhm,
along with radiation chemo. And if all of that fails, then you're looking at immunotherapy, where they use targeted PD-1 cells receptors to help with immunotherapy. So, and the survival rate is, of course, when you get stage 1, stage 2, Manu was diagnosed at stage 2. And just so
mm,
the listeners are aware, he was otherwise healthy.
mm,
It's not HPV related. He had it on the lateral border of his tongue, anterior tongue.
mm,
And there is a picture of it on Dental Town and some article I wrote, and that was his tongue. And, even though he had half his tongue removed, grafted, all of that, the cancer returned within 8 months. And within a year and a half of diagnosis, he passed away at 34. So
mhm,
age is, cancer affects everybody. So
mhm,
not be um, ignorant in the fact that I'm young and I cannot have, or I'm healthy otherwise I cannot have cancer. And he didn't have, he wasn't a smoker. He was a social drinker, but none of the risk factors except male, and male are more perceptive to, or more susceptible to oral cancer, older males. That's so, um, yeah, it affects everybody. You want to get earlier diagnosis, remove the lesion and get radiation. That was
mhm,
I feel, in my opinion, when Manu had his first initial surgery, which was an 8-hour surgery, and you had Howard on there. Manu actually talked about his surgery in Dental Town when he was on the cover of the magazine in 2019,
mhm,
a November issue. And right after his major surgery, the 8-hour surgery with this team, it was beautiful surgery, and it's a multi-specialty surgery. You have plastic surgeons, you have your ENTs, you have vascular surgeons, you have your oral surgeons. And after the surgery, they never gave him radiation or chemotherapy, which I think would have helped prolong his life, because the cancer returned, even though they did a neck dissection and removed lymph nodes. They did not there were some cancer cells left that were deep. So they went wide enough, but not deep enough. And that caused the cancer to, lymph, we all know cancer spreads through the lymph system, through the blood system. So it came back. So really being aggressive in your treatment, especially in the younger population, definitely helps.
Dr. Pearl, I just wanted to just say that sorry to see the loss of your only one brother, but it's something that build your strength, and I know you've been going around and give hope and give inspiration to other dentists. Talk a little bit about the book that you and your brother have.
Sure.
Yeah. Could you share, um, you know, uh, what were Pano thinking when the time come to him? Share with
Yeah.
us some of those moments.
So Manu was diagnosed just before COVID in
Mm,
2019. His cancer returned. After his surgery that I told you about, he had another swelling in his neck in
mhm,
April of 2020. And that's when COVID hit, right? Everything had stopped. And he was in Canada, I was in the US, and the borders had shut down.
mm,
And so I never saw him. He had another surgery. He went through chemoradiation. And that summer, the summer of 2020, he had just celebrated his 34th birthday. He rang the bell and he thought he had beaten cancer. He was doing really well. But that's when he decided, between COVID and cancer returning, that he's going to leave dentistry. And he
mm,
started writing his feelings about dentistry, about life, about cancer. And unfortunately, the cancer returned in December it had metastasized to his lung, and he had fluid buildup, and he was admitted for, he got a Plorex, which is, I don't know how people are familiar with. Basically, it's a tubing to drain the fluid buildup. So he had a lot of cell necrosis and fluid buildup. He couldn't breathe. And so unless the fluid was drained. And pretty much we were told that this is the end, and we have to make some end of life decisions. And also, that's when I flew in the middle of COVID without being vaccinated, with all the necessary restrictions between the two countries, getting a compassion release, signing it off to doctors, and, isolation protocols for Canada. And he told me he wanted to be published with all the work that he'd been writing. So he was writing about life lessons, knowing that tomorrow was not promised to him, about mortality, about hope, about the ability to endure, chasing trophies. And he had showed me an article that he was going to be published in Dentaltown. And I said, go for it. And that article is in the book, and it's titled Leaving Dentistry This Way Out. And he talked about his dissatisfaction with the profession and how cancer had given him a ticket. Dentistry is stressful. It's a very lonely profession if you're by yourself, and especially when you face such a life-altering illness. And it may not be an illness, and maybe any life circumstance changes your perspective of how you view things. And that's what it was for Manu. And I visited him, and he's like, I really want this published. And I said, sure, you work on that, because he didn't have children. He was single. And I will get you a publisher. And I found him one in February, and he said, I don't want to be published yet. I still want to write. I've got time. I'm like, sure, Manu, you've got time. Go write. And that's what you want to concentrate on. Unfortunately, Friday, March 12th, I was given a call that Manu's going to hospital. He had a pulmonary embolism, and he was rushed to the ER emergency. And he said, my parents said, he's going to be admitted. Don't talk to him. Let him rest. He's going to be overnight at the hospital. And the very next day, he was moved from, at this point, he was in palliative care. He was getting a lot of the treatment at home, being COVID. And he was moved into hospice. And I was asked to get there as soon as I can. Unfortunately, by the time I got my PCR testing done and I booked my flight this was on Sunday, I booked my flight for Monday. He passed away Sunday night. And I had to say goodbye to him just on a video call, like you and I are talking. And I said, you need to go. And when I walked into his house after his death, I saw everything in his house was the same. His food was still in the kitchen counter, his blanket, his medication, everything was the same, but Manu wasn't there. And it was his life interrupted. Life kept going. The sun was shining, birds were chirping. There was his mail that I picked up, and there was the article that he had talked to me about. And that dental article, the Dentaltown magazine was there. And that's when I started looking at whatever he had written. And I said, as his sister, much older sister, I remember when he was brought home from the hospital, to watching him take his first steps. When I graduated dental school, he graduated high school, he followed me. So I couldn't protect him from cancer, and I couldn't save his life, and I couldn't be there for his treatment, just the way life presented. This was all that I could do for him. And this was a way of healing. And he talks about him finding internal peace, about how all the accolades in the world couldn't help him as he struggled to breathe, but he was okay with what destiny had laid out for him. And he said that he would never lose hope, and he's going to keep fighting to the last breath. And he did, every step of the way. And I wanted to share his writings, share it with the world. And I helped complete it with writing the foreword and the epilogue, and how in the epilogue, I talk about, we move different parts of the world, and that makes us who we are, more resilient, different way of thinking. We're, as a family, as, fighters, and the aftermath of cancer. Cancer doesn't just affect the one person who has it. And if anybody who has gone through either themselves fighting cancer or their family member or loved one, know that cancer still sits at your table if the person's gone. And it still affects us to this day. He's not there and he's not suffering, but cancer still hurts us, and we carry scars that can't be seen. Those are emotional scars. So, and that's what the book's about, and the sharing, and it's just his message. He started this, journey himself about sharing. I'm just helping complete it.
You give anyone, first of all, just want to let you know that you have one loved one passed away in 2021. I have dad passed away for COVID late of 2000, and early January mom passed away of COVID. So so I understand your feeling, the loss of the loved one. And so now how we learn is to look up beyond, who we are, why we are here. That's why I was trying to arrange the conversation with you almost 6 months, but finally we're able to do this. And
Yeah.
and we both have that grieving period of our life, but we cannot just let that hold back us, but we should use the experience, the emotional experience to share, and hopefully get some hope for share some hope for other people as well.
Yeah.
Because life is short.
Life
But
is short,
the
unpredictable.
the beauty is, like you said, I think your brother, and you wrote in your journey, is what we left behind here is what inspire other people and give hope for other people. And we are part of the body with the soul in this body, and so the soul is eternal, and
Soul is eternal.
yeah, so it's beautiful. Share with us whatever you have, especially a dentist or medical doctor. We work so hard, and sometimes we don't take care of ourselves. That's the major problem. Is we don't take care of ourselves. We don't take care of our loved one. And we actually take care of other people teeth better than our loved one.
Absolutely.
And sometimes your husband or my wife may say, like, how come we haven't get the cleaning for the son for a while, or daughter for a while?
Yeah.
So
we make the worst patients as doctors, right? Like we know it all. Yes. We make the worst patients, but it's true. We, with our patients, we forget to eat. We're not sleeping. We're running behind schedule. We work late. Our jobs they make you deaf and blind, right? You're these noises and small spaces. You're crunched. Your back. Work in high stress areas, and it's very demanding profession. And it's pausing and reflecting on, like, and this is what Manu talks about, touches upon all these things. It's like, what are you chasing, trophies or, tangible things that you're after? Is it for yourself or for others? Stop and pause. We're always in this race. And you touched on a very great topic about mortality. Life is short. We don't know what tomorrow is, not promised to anybody, right? You could be in a car accident and not come home, or, life is so unpredictable. And that I would love to read a little passage on mortality that he talked about, and exactly what you touched upon.
Sure, please.
And, and that's what he said, that the human mind, body, and spirit they have such a remarkable capacity to heal, and we are more powerful than we give ourselves credit to. But this is on mortality. And he wrote, and I quote, "So in summary, what I have noted, that death is not a final destination that we slowly descend into after we have accomplished all that we are set out to do so in an orderly fashion. No, the concept of mortality is an ever-present factor in our life. Death, if you will, follows you at every step, and at every hour. You cannot escape it. Perhaps the best manner in which to cope with this reality is to embrace it rather than remain in fear of it. For your thoughts will not change the reality of how our lives proceed. What we can do however, is to give the concept of morality the respect that it deserves and translate that into a quest to provide a sense of fulfillment in our daily lives. And perhaps the most fruitful path to fulfillment is to provide valuable service to others. Now, I'm not asking you immediately to become saintly in our daily lives, but merely suggesting that we are slowly thinking beyond the self-absorbed sphere that we are so often caught up in. By providing thoughts and ideas that we hope to outlive us, we can start working towards creating our own solution of our mortality. That solution is in creating something of value that will outlast us. We will, in essence, take the first step of immortality, and that alone is our only hedge against the fear of mortality. Our lives will come and go, but our ideas will remain immortal. And therefore, in essence, the soul behind our work remains eternal. So seek not to fear your own mortality, but rather embrace the challenge to create something that will outlive your fears and wildest imagination, such that you may be able to provide service years after you have dearly departed. Live with the strength that is not only impossible, but quite tangible, if we can simply let go of fears that will not serve us in any purpose in this life or the next. End quote.
What a beautiful ending. I agree totally. That's exactly what you and me doing right now is,
Yeah.
in the next 30, 40, 50 years from now, you and me may not live, but this podcast gonna be useful for generation to come, and for people who, when I type in on YouTube or Google search oral cancer awareness, and they might see you and your brother book, and they search and check out more of the information. Same thing for dentists or healthcare profession. We work hard, but there is a purpose, the higher purpose beyond what we actually do, and that is to, like you mentioned in the book, is to leave something behind. When we pass away, the work that we do, the legacy that we left behind, is actually the legacy that for either our generation, our kid generation, or the dentist generation that's seen, and hopefully they build on that even stronger. And that's always about it, to build up the stronger legacy to the next generation, to pass down the good part. And
Yes.
with that said, I'm hoping maybe we will see you one day on your presentation.
Yeah.
I think you have two seminar, isn't it? Two topic that you lecture on oral cancer and
Right. I talk about oral cancer on my website, which is my name, Makkar.com.
mhm,
Yeah, I talk about oral cancer and surviving grief and challenges, what I had to do. Like when I learned that Manu was dying,
mhm,
was in the hospital and I was told he's going into hospice and you need to hurry up and find a way to get into Canada. I still had a whole load of patients that I couldn't cancel out on, and I had to refocus. And it's that being present in that moment and trying to work with what you have in that moment and forgetting, life presents us with all these challenges and how we have to get through them and come out stronger in the end.
mhm.
We cannot let life just passes by or life pull us down. We've got to rise above from it. And I just talk about those
Yeah.
things that help me.
Yeah,
Yeah.
my experience, just like you mentioned, like during the time when my mom and dad had to go through, when they stay in the hospital, the only thing I can do, knowing that I cannot be with them, is to pray for them, and that gave me strength, and also it taught me to to settle down and just like you said, just slow down and look around, and focus on the immediate need. But there's always when we face challenge, what I found is we only have to see that in the end it's going to get better.
Yeah.
So we look at the situation now, but we have to look beyond that.
Yeah.
That's the
We
only
hold
way
on.
for us to have hope,
Yeah.
because hope is something invisible, but we already know it's going to be there for us. But if we don't have hope, we don't have the invisible promise then you challenging.
Yeah.
So
And that's the first topic that he talks about in the book is
yes,
on hope. His first
beautiful.
chapter is on a hope that I may see tomorrow or not, but I will hold on to the hope that it will be better tomorrow. Whether it
Exactly.
happens or not, we don't know.
Yeah.
And you find your challenges. I mean, to lose both parents, were you able to see them or be at their funeral?
I were able to see on my mom and dad at their house before they went to the hospital. I was
Okay.
wearing N95 masks and went inside the house, pray for them, and also I was able to visit my mom one time during the COVID. Where there was a lot of hope, but it everything is planned by the creator of this universe, and um, we are just a human being living in the short lifespan, and
Yeah.
we have to look beyond the eternal life. That's
Yeah.
where it counts. So
Yeah.
a lot of us as dentists, working and being so stressful. I keep telling my friend, yeah, you got you got you have everything, house, car, family, everything, degree, you run in your business, there's day up and down, good and bad. But don't look just what do you have here, look beyond that. Then you're less likely because the day that you are no longer here, you can't even bring anything with you.
Not
Your
bring anything.
degree, your money, your wealth,
Nothing.
nothing. So
Nothing.
we were born, the Bible said we were born with empty hand, and when we leave with empty hand. So
Right.
when we look at that, just like me, I am free. I don't, of course you have to worry and take care of your patient, but I don't let my day go terrible because of one patient or another. But I look beyond that. Tomorrow is going to be a better day,
Yeah. Tomorrow's
So
going to be a better day.
yeah. So anyway, anything else that you would like to? Do you have the class that you can share the screen or anything that you want us to follow you so we can some of us?
Yeah, I don't know how to share this. Well, this is on Zoom. You can follow me on Instagram at Dua, DUA, good job,
Mm-hmm.
all together, and do a good job. And my website, which is parulduamakkar.com.
Mm-hmm.
And this book is available on Amazon.
Mm-hmm.
And I got featured by the American, Canadian, and the British dental journals.
Mm-hmm.
So its impact is really worldwide. And, of course, it's my little brother. So I have yeah, that's me there. And then we created a podcast, which Dr. Howard Friend, which you interviewed too, is my first guest on that.
Mm-hmm.
Yeah, we talked with Manu's closest friends who are all dentists and as well as doctors. And we talked about the book and life lessons and his last days because they were close to him. And yeah, I just got back from Alberta speaking at the Alberta Wellness Summit.
Mm-hmm.
But feel free to reach out in any capacity that I can help with and live your best life.
Dr. Parul Makkar, it's an awesome and time with you. It's an honor to be with you again. We share some lost loved one during a tough time where we cannot see them face to face, but one day we're gonna see them. So
Yes.
we just have to look at that way.
Yes.
Sometimes like we are so into this 10 year, 20, 30 years, but we don't realize that finally we're going to be rested as well. So let's just prepare for a good time when we are here, rather than
right. And energy is not created or destroyed, it's transferred, right? So there are
exactly.
energy around
That's
us
right. Yeah.
in protection, and a soul knows a soul. So you'll find each other.
See you next time. Thank you
Thank
so
you.
much.
Thanks, Doc.